Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law and Governor Healy's March 29th, 2023 revised order extending remote participation by all members in any meeting of a public body. This meeting of the Great Barrington Board of Health will be conducted both in person and via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the town's website at townofgb.org. For this meeting, members of the public and committee members may attend the meeting in person, or for those who wish to do so remotely may by following the instructions at the top of this agenda. For those who are not in person, every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. And we'll call the meeting to order with a roll call vote. Peter Stanton.
Aye.
Dr. Ruby Chang.
Aye.
And I am Michael Lanu, and I'm here as well. Our first order of business is approval of minutes from last meeting, which was on August 10th.
Do I make a motion for that?
Sure.
Make a motion to approve the meeting, the minutes from August 10th.
I second.
And we'll take a roll call. Peter,
Aye.
Ruby,
Aye.
and I vote aye as well. Minutes are approved. We'll move next to department updates.
Okay. Okay, so the Southern Berkshire Public Health Collaborative Fall Vaccination Schedule. Would you like me to pull that up now so we can look at it together?
Sure.
Or I can just summarize whatever you'd like.
Peter, can you hear Rebecca okay? We have the AC running. We'll turn it off if it starts competing.
No, I can hear fine.
Okay.
Okay, so here it is. There's lots of clinics to choose from. These are specifically flu vaccination clinics. There'll be 4 in Great Barrington total. The first is next Tuesday in Housatonic at the Hoosie Dome from 1 to 3. And then there'll be another 3, one at Town Hall, the Senior Center, and the WEB Du Bois Middle School. So those are the Southern Berkshire Public Health Collaborative flu vaccination clinics, but you can also check out the CHP mobile van. They're here at Town Hall at least once a month, and they offer walk-in vaccinations, both the COVID booster as well as the flu shot. Yeah, generally they're here the first week of the month in the afternoon. Oh, I forgot to mention about the Southern Berkshire Public Health flu vaccination clinics. They're asking that you pre-register, just so they can plan accordingly. And then if you have insurance, to bring your insurance card, but don't rush it.
When you register, they actually want to have that information there.
Okay. Okay. Good.
Okay.
And then next is the pesticides and children's health panel. So I'd like to spend about 5 minutes talking about this, and there might be some folks here from the AgCom that I'd like to promote to talk about this.
Sure.
Okay,
I see Vivian's attending.
Vivian, and that's maybe Ambrose, but I don't see him, and Devin. So Vivian, you can chime in at any time, but this is, we talked about this last month. It got moved to September. Dr. Evans from Mount Sinai will be presenting on pesticides related to children's health. The AgCom, Devin had asked us to promote this lecture, but speaking to Vivian this afternoon, she and I talked about having the Board of Health have a more active role in this discussion, meaning that the Board of Health could potentially host the lecture on Zoom. offer an introduction to the lecture, and then also potentially an introduction to Dr. Evans, and having some members of the Board of Health participate in the Q&A session following. So a prepared question from one or many of the Board of Health members. So a little bit more than just promoting. I mean, we would do that as well, but the thought is to have a very active role in this lecture and this event. So Vivian's here, you can talk about that, Vivian, but I just wanted to get your thoughts and or approval before we move forward with planning and promoting the event.
So is it still being held on the 21st, or is that,
That's the plan,
okay?
yes.
It's a little tricky promoting, I mean, taking such an active role when I don't know her, I don't know her work. But maybe others on the board do, I'm assuming. Do you know her?
No, I don't.
Her and her work?
No, I don't, but it's a very important subject
Mm-hmm.
to have, as far as you all know, it affects children much more closely, because the children are closer to the ground, they're younger. So it would be really important I think we should take this opportunity and really make the best of it. And whatever that I could do to help out with questions or to, promote this information, that would be great.
Would you like to take point on it and you can introduce her? I mean, if it's a Board of Health thing, I'm sure most of us will be in attendance. But would you like to?
Sure, I can do that.
I think Vivian has made a connection with Dr. Evans, so Vivian has volunteered to introduce Dr. Evans.
Okay.
Because of what she's been experiencing this last summer, and having stepped down from the Agricultural Commission as chair, she had asked that the Board of Health potentially be a backup to introduce Dr. Evans if she's not feeling up to it.
Sure.
Which I can do, or you, whatever, we can figure that out when the time comes.
Sure.
But I'm more than happy to host the Zoom and facilitate the Zoom webinar. And yeah, and then the secondary request is just for the Board of Health to participate in the Q&A to help facilitate an educational discussion.
It's 2 Thursdays from today.
Does she have any publicly accessible work that we can look at just to get an idea of that work? Any essays she's written or anything like that? Just otherwise.
Yes, I'd be glad to send you that.
Okay, that would be very helpful.
She's published a number of things. She's in the Department of Environmental Medicine and Public Health. She has a PhD and Master's of Public Health. She's not a medical doctor. So in that way, her work is more affiliated with the Department of Health than with somebody, like a hospital type of presentation. The Department of Environmental Medicine is kind of unique at the Icahn School of Medicine at Mount Sinai, which is a hospital, but she is not a medical doctor. She's a scientist who has specialized in pediatrics in relation to the environment. I heard her do a presentation in another city in Massachusetts, actually, and I was very impressed. And I reached out and I talked to her, and she's very amenable to working with us, and really would appreciate having input from the Board of Health as well as the Agricultural Commission, since we're not her usual audience. But we got involved because, as you know, we attended a number of Board of Health discussions about your regulations on glyphosate, and we certainly supported that. And we thought it was important for the public to understand that while the Board of Health regulation, it concerns town-owned or managed land, it also should set an example for everyone, for residents, et cetera, in town. And we thought that her presentation, which covers, some medical issues, but is very much oriented more towards public health and and the environment would be suitable for an area for us to collaborate.
Okay, yeah, if you could send some of her work just so I can get to know her, what she talks about, and otherwise I'll just be shooting in the dark with questions.
I can send that to you all tonight.
Perfect. That'd be very helpful. Thanks.
One other thing that we hope that the Board of Health will be involved in the announcement, to include in the announcement. In June, when we first planned this, before I was sidelined, we arranged for a flyer to be designed, graphic design, which is very photographic with young children in it. And we hope that the Board of Health can be listed there, maybe with the flyer also, or the announcement, press release perhaps posted on your website that could be also included in the flyer. From the point of view of the Agricultural Commission, each of us has committed to do personal outreach to either those that we work with or organizations that we're members of, like a Berkshire Environmental Action Team, Greenagers, Railroad Street Youth Project, the Great Barrington Tree Committee. So a variety of groups in the community. I promised to reach out to Superintendent Peter Dillon, who I've worked with on agricultural issues, and he can distribute to different school newsletters and things like that. So we hope to be involved. Also, we're not turning this over to you. We want to cooperate and work with you on this.
Okay, that sounds good. I see Eileen Mooney's in attendance tonight, and I'm sure she can put out an email to her email list once we get something formulated as well.
I was thinking maybe
Thank you.
the offices, any of the
I see your hand up.
offices, if you have a poster, I think all the parents that bring their kids in the next 2 weeks will take some comfort in knowing that they're getting free information.
Hmm. Can you,
Like CHP and NACME and some of the other family practices.
go ahead, Eileen. I think you can talk.
I absolutely will. I'll send something out as soon as I get it, and then again before the 21st.
Great. Thank you very much.
Thank you.
Okay. Anything further, or is that
That encompasses it.
okay? Okay, great.
Thank you, Vivian.
Next is Berkshire Mosquito Control. This is something that Ruby brought to my attention. It's a company based out of Pittsfield. It's run and operated by Chris Horton. And so what this company does is they contract with a town to survey various species of mosquitoes, and then they'll report to the town based on what they find for arbovirus, if any, in this survey of mosquitoes. And they do this throughout the season. And in the colder months, they'll work on like deconstructing dams or just like places where water collect, not dams, but just places where mosquitoes can breed.
Right. So actually his company is called Berkshire Mosquito Control Project. And it's actually backed up by the Massachusetts Department of Public Health.
Mm-hmm.
And so, as you well know, we get regular reports about the mosquitoes that are collected in our environment, and then they test for West Nile virus as well as triple E, which is Eastern equine encephalitis. And they send out reports like every week or every other week. And recently there have been some reports of West Nile in the mosquito, and more recently there's been report of Eastern Equine also in mosquitoes. And they raised the level of caution in the Berkshires to moderate instead of low risk. And there's actually 2 people that were reported in their testing of all of Massachusetts that had West Nile. So we are, the mosquito season for West Nile and Eastern Equine is into September. And most people that are vulnerable for it are usually immune compromised or elderly people. And they can have a febrile illness to more encephalitic kind of a picture. So I wanted to bring it up because we haven't used them for the past 10 years because we really felt we're low risk and we didn't really need spraying. But at the same time, I had called the state and asked, does anyone ever come out to Great Barrington to test our mosquito population or our larvae to find out what the population is and how many of them actually carry these 2 viruses? And my answer was that nobody comes out here. So they do come out to Sheffield and Otis, and that is where we're getting our information from.
The state does, the state comes out or the company
This
comes out?
company.
Right.
So, if we do, and this is something to think about, because we don't have actually close monitoring of our mosquito population. And part of Great Barrington is actually pretty swampy, it's lowland. So the question is, if we don't monitor it, how do we know how many of these mosquitoes carry West Nile? And how should we proceed with understanding its prevalence? As you well know, this summer has been very wet, and we've had a huge number of mosquitoes, and people don't even want to go out onto the park to play sports because they're eaten by these mosquitoes every time they go out. So what we need to know, so they're requesting that we spray. But as you all know, they said we have not recommended spraying for many years now. But I think gathering some information so we know what our choices are for the town would be important. I'm not saying that we definitely endorse them or use them or anything, but just to get information to see what they do and how do they handle if there were positive cases and what do they recommend.
Were you here last time when they actually came and presented to the board? It might have been before you were a member.
I
So,
don't,
so they came, I believe it's the same company.
they said 10 years ago.
Yes, they came, they came and presented. And they can do, so right up front, the cost is quite high to do extent monitoring for a town like Great Barrington. That was one of, at the time, the board, that was one of the considerations. They said the prices were so high for this maintenance. Or for the monitoring and the contract with them was tens of thousands of dollars for the town. And so right away, that was a kind of a big hurdle to get over, the financial side of it. The other side of it is they do monitoring in certain areas. And they do, if they start to get so one of the things they do is they use I can't remember the terminology, but they use a product that goes after the larva of the mosquitoes. So they kind of have a step-by-step thing. But
Yeah,
what it came down to and this is just from previous perspective of the board, was if in fact they comes to spraying, that my understanding was, well, at the time, and still is, that they use a full spectrum insecticide that they spray. So it kills everything. And there's no way it kind of, whichever the way the wind blowing, that's where that stuff goes. And so it was a highly uncontrollable method of spraying. It's not like we said, oh, we found them here, we went into that area and sprayed. And then along roadways, because they use the roadways to spray. If a property owner said, oh, we don't want spraying, they literally turn the truck off when they pass the frontage and then turn it back on. Now, if this is wrong information, I'd be happy to correct my understanding, but at the time he said, well, it's not very effective. And I think they were people in Richmond who had dealt with this issue before. And then they said the same thing, that the spraying was not really an effective way of dealing with it. So it came down to this issue of if you do this monitoring and if you find that you have you get positive results for Triple E or West Nile, the spraying part of it, how effective is that? And so it comes down to this thing where we're doing all this monitoring, but there's nothing that we can know for sure that we can do about it. So other thoughts too were, well, we know that this is possible to be out there, but we're not seeing any cases in our town. And some people have said, well, until there is a human case in the towns aren't gonna really care about it. So that's just some previous thinking or earlier on when they presented. So, but I think the major part of it was the financial aspect was actually quite high.
Yeah, so I did ask him about that, and Sheffield pays $1,000, about $1,181. Sheringham pays $353. So
And now is that just for monitoring?
for monitoring and whatever they do for the season. They use something called Amble 10+10, which is toxic to invertebrates. And it also, it's non-discriminatory, so it kills
Yes.
mosquitoes and all of the insects that are there. They spray it and at night to when people are less likely to be exposed to it. But it does affect even our fish population. They said that there is no risk to drinking water sources. However, they do feel that if you have a beehive, you would need to cover it. So what I'm trying to do is just to get newer information so that we have it available. If we have really bad mosquito, year after year, we have something to think about for the town. I think that Board of Health, we need to explore what is available, and then we can make the determination whether we want it in this town.
I guess my feeling is unless they are using different products, I would not be in favor of any
Yeah.
kind of spraying ever.
So one thing that they do use is that they use a larvicide.
Yep.
And so the larvicide is actually a bacteria. So they spray it onto ponds where the larva is, and it doesn't really do anything to people or other types of insects. But I don't know the whole details about how that works. So all I'm saying is that with the mosquitoes and people complaining about mosquitoes and wanting to spray, that we should have an answer for them. So this is your option. We either spray the town and have all these consequences, or we don't spray and you take your individual responsibility much more seriously and teach your children to make sure they wear appropriate clothing with permethrin on it, that you don't wear perfumes that may attract mosquitoes, that you may want to use sprays on your body that, repels all of the mosquitoes, and wearing clothing that's more appropriate, like long sleeves if it's cool enough to do that. So those are all other things that we could do, including getting rid of our standing water, like in old tires and, in buckets that we just happen to leave out with rainwater, which are perfect sources for larvae to produce mosquitoes within a couple days. So that we have a clear understanding in the town that these are the choices that we have. This is what you can do personally if you don't want to have spraying occur in your town. That everybody has a good sense of what our choices are.
And I spoke to Chris, and I did invite him to our October meeting, and you can tell me if you want to proceed with that plan or not. And it's good to, of course, hear what he has to say instead of me just relaying what he said. But I got the impression that they would not take any mitigation steps if any arbovirus, which is Triple E or West Nile, without the Board of Health's consent.
Yeah.
So which was different than my original impression. I thought that if they did the surveillance, then they got to decide on what kind of mitigation strategies. That's not the case. We can just choose to have surveillance without laying any insecticide or pesticide. But of course, it would be good to hear Chris
Yes,
explain that.
it sounds like we should have him at the October meeting. He can go through with what they do, and it's been a while since I've heard from him. And I'm guessing it was the same company, because I know they use other towns.
As Ruby said, this is the company in Berkshire County
Yeah.
that DPH contracts with,
Yeah.
so. They have a pipeline of information. If there is arbovirus, then DPH, would be notified of that. So yes, they are the local company.
Now, we applied to opt out of spraying. Was that from the state? Was that
Yeah,
and how does that tie in with?
I don't know how that would tie in if there's ever a second or another state of emergency, but we applied for an exemption during a state of emergency that Governor Baker had declared, because there were 6 human cases of triple E in 2019, thank you, and triple E, usually is heightened in a 3-year cycle. So that state of emergency went for 3 summer or warm months. And DPH kind of did a poor job of advertising local boards of health rights. But this exemption was us declaring that we didn't want aerial spraying happening over Great Barrington. Even though there's this state of emergency, that the governor.
With the declaration of the state of emergency, that gave them the right to decide when to do that for towns, unless they offer that. But you had to be approved to be out. Right,
You got that correct.
right, okay,
So, so going forward, there's nothing to opt out of, because
Unless-
there's no aerial spraying. It's only, like I said, when, the governor and the Department of Public Health, think that triple E or any arbovirus is at such a height where they would have, like, waive local control.
okay.
They go down all the way, you answer them.
Yes, you have lots of time.
Yeah.
Yeah. Okay, well, let's do that then. Let's invite Berkshire Mosquito Control to October meeting. And we can have them present to us what they do, what our options are. I think that would be a good thing to say, but that's what we're requesting, general presentation and options and associate costs for a town like Great Barrington.
He gave me an estimate of $10 per person. So,
What does that mean? $10 per,
so that's the average contract cost, and that would line up with your numbers for Otis and Sheffield. Whatever, $10 per person,
I mean, for town
person.
resident?
Mhm.
Oh, okay.
So like if a town has, 300 people, that would be 3,000. That would be $10 per person.
Wow,
So
So Great
it's-
Barrington, what's current population of Great Barrington?
7,000.
Yeah.
So 70,000? That's
Um,
like,
that, he didn't give me an exact number, but that was the
I
estimate.
remember it being quite high, quite in the tens of thousands, the last time they quoted years ago, so. Cause it was such a big town.
And he did say that Pittsfield holds the biggest contract. And I don't know what this means, but he said that because Pittsfield has such a big contract, other towns aren't charged as much. So anyway, this is all good
It would be-
information to
it
get
would-
from him.
Right, it would be good to get an updated quote so we know what we're talking about. I remember it's fine, it's already been 10 years, wow. Seems like just a few days ago. Okay. Well, very good. If there's nothing more on that, we're down to Board of Health. Questions and updates. Do any members of the board have any questions, updates, general thoughts about the state of things?
I just wanted to, report that looking at the numbers from the CDC, is that the COVID cases are starting to go back up. This occurred even before school started. I think there is, the main reason I think is because the weather has been rather uncomfortable to be outdoors. And I think people are congregating indoors, a lot of times now, and so there's more crowds. People are getting used to going to concerts and very close tight spaces. There's especially been more, a rise in cases in the Northeast, as well as other parts of the country. So the main thing is that if you look at what the recommendations are for masking, is that, as you all know, we don't have any recommendations as a department here. However, for your own personal support, we just want to reemphasize to make sure you're using N95s or KN95s, and make sure that they're tight on your face if you are to use it. The rule of thumb is if you're in that elbow tight space, that's indoors especially, then you should use it if you're there for longer than 10 minutes. And if you're outdoors and you're in elbow distance with each other, then it would be good to even use it in those types of situations. Especially more likely if you are elderly or you're immunocompromised. So I just wanted to reiterate that we still need to, protect ourselves as much as we can. If you do catch COVID and you're in that group where you're elderly or you have other types of immune compromising situations, you should definitely contact the primary care as soon as possible, because there is medications that can help prevent it from getting worse.
Have you seen any of the recent studies about CO2 toxicity in N95s? Are you familiar with some of that work that's coming out?
I haven't really seen anything about carbon dioxide when outside inside your mask and what does that do to you. But I do know that I wear it all the time when I was at work. I don't remember ever having issues. We wear it in the OR, we wear it pretty much consistently during the whole 8 hours that I'm at work, or 10 hours, whatever that may be. So I don't really know if there had been, because these masks are designed to allow air to come in and out. So
I've been reading some stuff recently that's been brought to my attention. I'll send it to you and see what you
Yeah.
think. I think it's particularly for some of the concerns that are out there are for young kids being required to wear these in attendance of schools. So it will be interesting to see how the debate takes shape, because we've been through years of the actual pandemic,
right.
when all these
So-
requirements were put on people, but the effectiveness was actually quite low. So
It's actually pretty good. I mean, the studies have shown that it's about 80% effective, if you wear it correctly. So it does prevent.
I haven't seen that. I haven't seen those numbers updated from stuff that's come out recently. You'll have to send me those so I
Mhm,
can see.
I can do that.
Okay.
Yeah.
And I'll do it likewise. We can trade. Okay.
Yeah.
Okay. Not to interrupt you if you want to keep going, if you'd like to. Anything else about CDC recommendations that you want to say?
There is no recommendation at this point as far as schools goes.
Right.
Or it's just your personal, you have to just be aware to have some of the masks available. So if you are in such a situation under those circumstances, you can consider putting them back on.
Mhm.
Because the rates are definitely going up.
Okay.
Yeah, and for our October meeting, I'll ask the public health nurse to give us another update on what our COVID numbers are.
She said that there was like 15 for Great Barrington and more like 30 for Lennox, and yeah.
And that was
That's what I
from
remember.
the beginning of August through today. So about half in August and then, 7, give or take, in just this first week of September. So
And these are positive cases?
these are positive PCR confirmed cases. A lot of the antigen tests that people have now are expired, and I don't know for certain, but there's a lot of talk that the antigen tests that are on the market aren't detecting this new variant, that I don't think has been named yet, of COVID, so.
There's two new ones I'm aware of, that they have named.
They have named?
Yes.
Oh, okay,
I think Eris was one and
Phi?
Corolla was another.
oh, okay, I thought Phi was the next Greek letter, but anyway.
I suspect we'll have an unending alphabet soup
Okay.
of variants
Yeah,
spreading on into the future, but
so, yeah, we'll talk about this again in October and see, and hope that the schools fare well this first month. I did last week drop off a bunch of PPE to the Berkshire Hills School District, masks and 95, or surgical masks and 95 masks, Kleenex, gloves, so just to get rid of a little bit that we have downstairs, so if
And-
anybody else wants some PPE, just let me know.
in terms of hospitalizations, are we seeing any numbers there? Or is it just, we're just seeing cases right now?
It's been going up, but the actual numbers, I don't have. I get regular, information from various public health, officials. They have like newsletters that come out every week.
Mhm.
But the rates have been steadily going up, not so much here, but in other parts of the country.
The hospitalization rate?
Maybe we read the same thing, and this is on a national basis, not a local basis, that emergency department visits are up, but not hospitalizations, from what I've read,
Mhm.
which maybe is not all encompassing, but just emergency department visits,
Okay,
so.
all right.
Michael?
I don't have anything to add. Oh, Peter, go ahead.
Yeah, I just wanted to, just a little administrative thing. I feel
Yes.
like in the, some years ago, we would do special permits and other things first and then get to the health department updates and board business later. And I'm
Mhm.
thinking that just in going forward, that to be respectful of people's times who are just here for that, that if we kept those things towards the front of the agenda, might be good.
Anything else to add for Board of Health updates?
No.
Okay, all right. With that being said, we can move on to special permit and site plan review for WDM Properties at 37 Main Street. Well, that's their address. This is for the redevelopment of the former Houstonic School. So, put it succinctly, is there anyone here for that? Ah, yes.
There is someone here,
Okay,
I'm gonna promote Steve Mack to present on this special permit application.
and this is this just a recommendation
This is a
to,
recommendation to the select board, I think.
Okay.
Let's see who we got. I'll check.
okay,
Can you hear me?
we can.
Hi,
Good
it's
evening.
Mac from Foresight. And we are the engineers for the project. And it's a special permit to the select board to convert the former Housatonic School to 8 two-bedroom market rate apartments. We've been to the planning board and we've been to the Conservation Commission for their recommendations. Projects served by town water and sewer, or municipal water, town sewer, and we're replacing those connections in their entirety. So we're abandoning existing water and sewer connections, replacing them. And there's not too much work from a site point of view, but I'm happy to answer any questions. We are looking for a recommendation to the select board.
Okay. Rebecca, did you have anything you want to say about this one?
I don't, it's
Okay.
on town water and sewer.
And so I understand you correctly, you're renewing those connections, the town water and sewer?
We are, yeah, we camera inspected the services, and the sewer was sort of crushed and disjointed. So we're just going to abandon that and put a new connection in. And the water is too small, so we're going to put in a new 6-inch line for fire protection. It'll be sprinklered. And so the existing sewer or water will be abandoned in place. And there was a question, there will be a whole facility water treatment unit for the project
Okay.
because of the issues. So that will be part of the project.
Okay. Ruby, there's a button right in the middle. It has like a 0 on it. It's like- Sorry about that. I'm sure other board members, but particularly myself, I'd be curious to hear a little more detail on your water filtration unit that you're gonna do for the building.
I can get that to you, but I don't have, I'm not, it's the mechanical engineers doing that, not me.
Okay. Success. Okay, Ruby, did you have any questions for them? He said they can get us the plans for their water filtration system they're gonna use for the building.
What kind of filtration is it?
Do you have a general idea of what kind of filtration it is?
I don't know. It came up the other day, and the applicant, Dave Carver, just committed to the fact that it's being designed currently and it will be included.
Okay,
There are different kinds of water filtration systems. Some of them really require quite a bit of expensive upkeep, and there are others that they all do different things. What are you trying to filter out?
Yeah, I think it's going to just address the water issues. The commentary was that it would be removed when and if the municipal water is corrected. And that was conversation with the planning board, but
okay. So that's something that's being designed specifically or a system that's just being gonna be determined and then purchased?
no, it'll be designed specifically. They'll take water samples and gear it towards what's needed to treat this water.
Okay,
So we don't have any information on that right now. Is there asbestos in the building or lead?
There was, yeah, some of it's remediated. They're currently working on remediating some of it. And when the project gets underway, it'll be completely remediated to residential code.
Right.
okay.
Is there any common space or kitchens outside of the apartments?
There's some common space in the basement in terms of storage, which isn't terribly common, but I don't know if you've ever been in the building, but the hallways are very, very wide, and the anticipation is that they will create sort of lounge areas within the hallways as the sort of unit owners develop relationships. But it's really going to stay similar to the way it is, but they're hoping, yeah. That was another conversation on the planning board.
Okay.
I
Any
don't
other?
have any other-
Okay, well, we don't have any other comments. Peter, if you don't, I'll look for a motion to pass this on to the select board.
I make a motion to pass it along to the select board.
A second.
And our roll call vote will be Peter,
Aye.
Ruby,
Aye.
and I vote aye as well. Great, thank you and good luck with the project.
Thanks a lot. I'll try to get you the info on the water system if you want that.
Yes, we do. That would be great. Thank you.
Great. Bye. Have a good night.
Thank you.
You too.
Good night.
All right, next is returning to or actually having a public hearing to consider our revisions to our local tobacco regulations. We've already spent a few meetings talking and hashing out. I think we have a decent shot at getting that done tonight, so I think I'll look for motion to open the public hearing.
I make a motion to open the public hearing.
I second.
All right, and for roll call, Peter,
Aye.
Ruby,
Aye.
and I vote aye as well. All right, we all know, we've been through the regulations. We've had Jim Willis help guide and craft these. from what I can remember at our last meeting, one issue that was kind of up in the air was the issue of permit, retiring scheme. And it sounded like from our conversation that it made most sense just to leave that policy as we have, which we have a cap, which I believe is 12. And it didn't sound like the board wanted to move ahead with a retirement scheme at this point. And it's certainly something we can do. I mean, these tobacco regulations come before us every few years, and we can certainly take that up again, unless I was reading the room wrong at our last meeting. And
No, it makes
as I
sense to me.
leave it as is?
Yeah.
Yeah, okay. And I'm fine with that.
To leave the,
To not at this point, start with a retirement a permit retiring
but we're
program,
not adding
but
anymore.
we're leaving our cap in place at
So
12.
what happens when someone returns a permit? Can someone else get it?
Yes.
I see.
So right now, I believe there's 10 out of 12 that are being held.
Oh, okay, so it's not even the,
Yeah,
okay.
and
You know, I was thinking about, medallions associated with taxi drivers in New York City.
mhm,
So once you limit the permit, the interchange before, to get that permit, almost like it increases the price
mhm,
of the interchange.
mhm.
Yeah.
Okay,
Okay.
is there anything you wanted to go over, Rebecca, or bring to our attention?
I wanted to make sure I had it right. Okay, here, number 6, under tobacco product sales permit. The effective date of this regulation, no new adult only retail tobacco store shall be located within 25 feet of the existing retailer with a tobacco product sales permit, and then there's language, farther down, to say, within 500 feet. And so I think we left it, that there were no 2 tobacco permit holders within 25 feet, but I just wanted to make sure that you wanted that distance as opposed to the, no 2 tobacco retailers within 500 feet language.
Oh.
I'm wondering what the point of having a limitation like that is. I can understand it when I've heard that in the context of, with near to schools and things like that, but I don't understand what it matters in terms of how far they are apart.
Well, we could ask Jim. I think I saw him signed in. Maybe he could.
Not him a few times. He did say that he was going to be
do that.
on a different meeting at the same time. So,
Oh, okay.
I'm trying to promote him, but, I think the public health idea behind that language is just, more opportunity for folks to purchase, tobacco products, which the point of these regulations is to limit that. So, if you add language in that no 2 tobacco retailers could be within 500 feet, that's potentially, preventing someone from purchasing a tobacco product or inhibiting them from purchasing a tobacco product, which I don't know if it actually would inhibit, or I don't think it would prevent, but sure, it could inhibit.
Yeah, I didn't quite understand that either, because I think it's more important if you're on a city block and you're so close together, but I didn't.
This is a local rule, so the only language that we're kind of bound to editing and we're incorporating in this new version is this fine schedule,
So,
for violation. So
Yeah.
all of what's above here is up to you guys to decide. It's a local decision.
so 25 was what was suggested?
That's where we left it.
All right.
So,
Well,
but you don't have to have either of the 2 options in this regulation. You don't have to restrict the distance between 2 or multiple tobacco retailers.
or wouldn't it
That
be
is a
like,
local decision.
like you were saying, if you have some sort of setback, the idea is that discourages density of tobacco retailers, so we're not stacked up.
Mhm.
Also, it prevents people from just going from one store to the next. So
Well, if you have a density of stores, then you just have more availability.
Right.
So, I mean, it seems for our situation, for our town, I mean,
I almost feel like the distance should be further apart instead of 25 feet.
25 feet is just one, I mean, so that basically mean not next to another building. I mean, we don't have, I mean, on a main street, you could see two storefronts. You'd have one storefront potentially in between. I mean,
Right.
Yeah,
at
I
some
think
point,
that's fine, just
leave it at 25 feet?
okay.
Okay.
So,
Are you good with that, Peter? Just leave it at
Yeah,
25?
I'm fine. I think it's so unlikely to come up as an issue, but I'm
Yes.
fine leaving it.
Okay, well, let's leave it there for now. And you're right, Rebecca, that was the other thing that we had to talk about,
okay.
was the time periods for fines. Is that what you were getting to?
The time period.
Yes,
Yeah.
and Jim brought up a good point last time that we had made it we hadn't given ourselves any room for adjustment based on, we had kind of narrowed ourselves down, so we didn't have any room for discretion.
I didn't make changes based on his comments, so
Okay.
what you see here is what we left in per the last conversation, so, let's see. This is the first violation, a fine of $1,000 shall be issued, and additionally, if the violation is a sale of a tobacco product to a person under the age of 21, the tobacco product sales permit shall be suspended for up to 5 consecutive business days. Do you want to leave that?
Right, so my understanding was if we say for up to, that gives us the ability to say, well, in this case, it could be 3,
Okay. Mhm.
but the most it could be was 5.
Mhm.
All right.
And then for the second one, it's 15.
Mhm.
Okay.
Yeah, I was fine with what our upwards limit. I just wanted to make sure that we had that, like he had mentioned, we had that ability to
Mhm.
use some discretion if a circumstance called for it,
Mhm.
rather than being locked into, oh, no, it's 5 days, oh, no, it's 15 days. But
Okay,
it seems, my understanding is that language would seem to allow us that flexibility.
okay.
If so, I'm good with leaving it as is.
Okay, that works. So, I think there's language, I don't remember where, but if there's more than 3 violations, I just need to ask Jim this question, but I think if there's more than 3 or if there's 3 violations within one year, we have to suspend. We have to suspend that permit. That's a
The
state
rule, yeah.
regulation.
Yes, I remember that. Yep.
So, yeah, I just wanted to mention that.
Okay.
All right. Well, if there's no other edits we need to look at or review,
Is there anyone?
yes, that's our
Okay.
No open public comment?
yes, we can open public comment. If there's anyone in attendance tonight who wishes to speak about these updated tobacco regulations, raise your hand and we'll hear you. We just have a time limit of 5 minutes. And I'm not seeing any hands at the moment. I'll give it another minute or so. From the names I'm seeing, I'm guessing that they are not here to talk about tobacco sales or regulations.
Right.
Well, not seeing any hands up. I think we've discussed this. Is there anything else you guys want to discuss, Peter or Ruby, or should we look to close the public hearing and take a vote?
There's someone.
I don't have anything to discuss.
Oh,
Yeah,
I see.
I'm all set.
All right, we see one hand up to talk about the tobacco regulations, and it's Kathy Regan. So if you just state your name and address for the record, and then we just ask for no more than 5 minutes on this issue.
I'm so sorry. I thought this was over and I was going to put my hand up for citizen speak later on. So I'm not talking on this issue, but thank you.
Okay, we'll get there as quick as we can. Okay, so I will look for a motion to close the public hearing.
I make a motion to close the public hearing.
I second.
My roll call will be Peter,
Aye.
Ruby,
Aye.
and I vote aye as well. And I'll now look for a motion to adopt these updated tobacco regulations.
I make a motion to update the adopted regulations, or the adapted regulations.
I second.
And we'll take a final roll call vote. Peter,
Aye.
Ruby,
Aye.
and I vote aye as well. Great. Thank you, Rebecca, for your work on this. And to Jim. It's a lot of juggling and updating, and that's good. I'm glad we could update those.
Michael, I have a suggestion that
Yes.
in general, the speaking time would be more like 2 minutes.
Okay, well, we had 5 minutes on our agenda, so
Okay, got it.
I was pretty confident that we would have very few people to speak about it. But yeah, I hear you. I agree.
Okay.
So with that taken care of, we'll move to public hearing for the review of the correction order for 179 Main Street. So I'll look for a motion to open the public hearing.
I make a motion to open the public hearing on 179 Main Street.
I second the motion.
And I'll take a quick roll call. Peter,
Aye.
Ruby,
Aye.
and I vote aye as well. All right, Rebecca, do you want to take us
Sure.
through?
Yeah, okay, so I've got the correction order here for 179 Main Street. Myself and Stephen inspected the unit on August 17th, and we were responding to a complaint from the occupants for a leak in the living room. And so when we got to the unit, we found several other violations. I won't read all of this here, but I'll summarize. There are 12 violations in total, 6 conditions deemed to endanger. And so just starting here, we did confirm evidence of a leak in several places in the unit. You can see that on the pictures there. I hope you can.
Mhm.
This is a bucket in the bathroom that was meant to catch a leak in the ceiling there. Second,
So that was the first issue.
that was the
leak.
complaint that we were responding to, and
Okay.
it was confirmed
Okay.
that there was.
So that's the
leak.
first condition, deemed to
Yes,
endanger the leak.
that's
Okay.
the first condition. And the landlord's here, but we're gonna go through this presentation first, and then
Yes.
we'll give you time to comment. I know.
Yep.
That
Okay.
maybe that violation has been corrected at this point. But we'll get to public comment in a minute after we're done with this presentation.
Okay.
All right, and the second violation that's here is evidence of a rat infestation. So this is a cabinet in the kitchen that the occupants had secured. They had closed this off because they knew there were rats in there and they didn't want the rats to get into the rest of the unit. So you can see the rat feces here, and then just kind of the evidence of a nest. And so this was a second condition deemed to endanger. Okay, and then we observed a lot of garbage in the back of the building, and so
Outside? Yeah.
outside. So there's a dumpster that either was not sufficient for the occupants' use, and it garbage was accumulating outside of the dumpster. It's possible that occupants were not putting it properly into the dumpster, or but either way, the dumpster was not watertight, and it was a food source for wildlife. And you could see the garbage that was strewn down the riverbank.
Okay,
So this is not a condition deemed to endanger. This fourth one here, you can see the small camp cooktop that the occupants were using because their oven and stove was broken. They explained to me that this was broken when they moved in, to their unit. But the housing code says that you need a conventional stove and oven.
Mhm.
And this, so that was a condition deemed to endanger. I don't know why this was not one of their complaints, but there's this really big hole in the ceiling of one of the bedrooms. That's a massive structural defect, according to the housing code. So that is a condition deemed to endanger.
and is that plaster or drywall? That's
It's the ceiling, so, I don't know, I think it's drywall.
sheet rock?
Yeah.
Okay,
All right, and so, this one, it's interesting, the building, so number 6, I cited this as a condition deemed to endanger. It's not explicitly in the housing code, so I want to have a discussion about this and get your opinion. This building, the property card says it was built in 1900, and so the building code takes effect in 1972 or 1975. So the housing code, when referring to egresses, refers to the building code. And so in this case, it would be considered a pre-existing non-conforming situation, where there's only one egress, if I didn't say that before,
Mhm.
for this unit. So, there's 4 rental units in this building, and, two are separate, like 2 and 2 are separated. This one that we're talking about has 1 egress, 1 entry exit for 2 units. It's on the 2nd floor. So
Can I talk?
after the presentation, you will have plenty of time
There's
to.
no show.
Keep going.
So, because this is a 2nd-story unit, there's 4 people living in this one unit that we're talking about, and then I'm not sure how many in the other unit, but regardless, we're only talking about this one particular unit. That's 1 entry and exit for 4 people, 2 children, to get out in the event of a fire or emergency. So, we do need to have a discussion about this, but I've determined this to be a condition deemed to endanger. Okay, and so, this, moving on to number 7, this is
Mhm.
the bathroom ceiling. Bathrooms, according to the housing code, need to have either natural or mechanical ventilation. This bathroom does not have a window, and so it would need to have mechanical ventilation, and you can see that there's a missing vent.
They have,
You took it? Okay,
Okay.
well, we'll talk about that too. So, but at the time of my inspection, it was missing, and you can see that there.
Mhm.
And again, this is another violation that I determined a condition deemed to endanger, and I've referred this and then the egress violation to the building inspector. It's not official yet, so they haven't sent me we've had a couple conversations, but anyway, so the unit, the front of the unit faces the road, and then the back of the unit goes in the direction of the Housatonic River. And so the majority of the unit faces the road, but then there's a hallway that leads to the kitchen and then another bedroom. And so once you step over the threshold from the hallway into the kitchen, it's pitched downward significantly, so that I assumed that there was some structural defect happening. So of course, I think at the very least, I would recommend that you have a registered design professional ensure that this is in fact a structural defect or not, but that we leave it as a violation until we can prove that it's otherwise not
Mhm.
a structural defect. And I think the building inspector would agree with that too. not a condition deemed to endanger, but something that's necessary in the warmer months. April 1st through October 31st, all windows need to be equipped with screens. There were, I don't think, any windows that were equipped with screens at the time of the inspection.
There wasn't any screen.
There were not any screens in the windows. Maybe one in the child's bedroom, but I didn't see it. But either way, all of the windows need to have screens.
Giving screen money, directly, portable screen. I have 40 apartments in Connecticut, Massachusetts.
Mhm.
You took, okay, I'm gonna talk
Well,
to you.
yes, we'll go back through them.
Okay, I'm almost done. And so this last picture here is, you can see the window is falling away from the casement. Which is allowing bugs and other types of insects to get into the unit. So not a condition deemed to endanger, but definitely a violation that needs to be fixed. The floor surrounding the toilet was wet, and we observed a leak when flushing the toilet, not a condition deemed to endanger. And then the residents left a placard with the owner's information, and that's required for rental units. So, given the amount of violations that we observed and the amount of conditions deemed to endanger, I would like to discuss with you, but my recommendation would be that you would consider condemning the unit. The summary has led me to conclude that it is unfit for human habitation. A complicated issue, of course, because there are occupants there, and it's not easy to find housing. So, I mean, we can discuss this, but I would encourage you to consider making that determination, but also putting an effective date out a little ways, like 30 to 90 days. So the occupants can have an opportunity to find emergency housing or alternative housing. And it's kind of a backwards way of going about it, but from my experience with housing issues, it is oftentimes easier for people to be bumped up the list to find emergency housing if their unit is condemned. I'm not saying that that's the reason why you should consider that, but just know that some opportunities do open up for people that are not otherwise there, if the unit is condemned.
Okay,
So,
can you pull I have a feeling we're gonna go through each point.
sure, sure.
We'll just pull that back up.
Yep.
I understand too from our conversations, you've had some trouble getting back in for re-inspections.
Oh, I should mention that, yes, so, when conditions are deemed to endanger a violation, so the obligation, so normally we look at correction orders within a 30-day timeline, but any violation that is a condition deemed to endanger needs to be remedied, corrected within 24 hours of the owner receiving the correction order. I have not been able to get back into the unit. We've tried, and scheduling, hasn't lined up, but I haven't been able to confirm, that Ginny here has complied with the correction order thus far. But either way, I would have liked to get back in just to give you an update. So I haven't seen the unit since August 17th.
Okay,
Can I talk now?
is there any other comments from the board before we hear from the property owner?
I'm trying to clarify the egress situation. So there are two apartments that uses one door to come in and out.
Yes.
No.
Where is the door? Does it go to the front of the street or does it go to the river?
It goes to the street. It goes to the sidewalk on Main Street.
Okay.
So so what you observed, there's one door that enters into a common hallway that brings you to, then you
Yes,
can go to either one apartment or the other?
from what I observed, I didn't see a second egress. You go in from the street and there's a landing and then there's two apartments on either side.
I see, okay,
Yeah.
from your observations?
Yeah.
Okay, and your name, sir?
My name is Jimmy.
Jimmy?
Yeah, that's all. Listen, I'm gonna go slow, one by one.
Yes, please.
You see, the apartment, they took it in March 20, I got off the March 29
Of this year?
this year.
Okay.
I own the building 30 years. I don't have no problem. They take March 30, 6 months. 3 months he no pay. When I ask him for pay, my bank check no good. Boss no pay me this and this. That's why I start. So before I give him the apartment, I have 2 guys. He fix everything. He painted everything. He inspect the apartment. He took it. I don't pull gun who have to take the apartment. His choice, he took the apartment. Number 2, egress, he have he have 4 apartments, 4 story and a bottom. And at top, they have egress, any apartment. It's not 2, you have 4 apartments, 4 egress. You can see, I show you what is there.
So there's another egress out of the apartment?
4 apartments, they got 1 hallway, 1 apartment, you have, 2nd floor, 2 hallway, 1 hallway down, 1 another side, 1 hallway, 2 apartments, another hallway, 2 apartments. Any apartments have egress,
In the apartment itself?
right? Any apartment, 4 egress, not 2 egress. And the garbages, I have dumpster in the back because the guy is mayor, let work. You have garbage in the back, throw for the window, the bags down. You should go bring it to the, I pay the $300 every month, the garbage.
Mhm.
It's no more responsible to go take care of the garbage. The guy is in drugs. Go, they don't know that. After start, he paid just 2 months. He been over the 5, 6 months. 3 months no pay. After he start, he broke the things. Maybe broke. I never been inside. I bring people food to fix the roof. There's still leaking there. So I hired the company. I paid $20,000 for brand new roof.
For
Right, yes.
over the whole building?
Right.
Okay, and you just had this done?
$20,000.
Okay,
Because I call company is this, come this week, come this week. That's why.
okay,
But the guy is in trouble. You see, another place he been, I'm crazy, to check up what he did. Because the guy, come from apartment, their girlfriend come. Another place, pay get evicted too. You wanna avoid, he's on drugs, so you need money for drugs, so no pay the apartment. When you no pay, you no have nothing.
okay.
I don't say I'm not gonna fix it. Everything what you should say, this on this window, this, I've given you screen, portable screen. The portable screen to put. The bad toilet, why you take the apartment? Apartment is good 2 months, after only start paying, his apartment no good.
So, one comment I'll say so far, so I appreciate and understand the financial part, I understand what you're saying about.
I know say I'm not gonna fix it, I could just fix it, $20,000.
Sure, in terms of whether the tenant pays rent or not, while I appreciate the difficulty that gives to you, in terms of what our business, that doesn't have any bearing on what we see.
I understand.
So just so you know, I understand,
understand.
and
But you just start,
yes,
because I go, all day you lie to me, next week, gonna pay next week. After we agreement, that's why you start, he broke things, everything.
sure, so as
The problem, why, I have 8 tenants of it, nobody complained.
okay,
In 30 years, never been of the, no tenants, I never been in meeting for anybody.
Even so, that's beside the
If
point.
something, I understand, I'm a over 40 apartments in Connecticut.
Yes,
Something wrong, we fix it. It's no big,
Okay.
big problem.
so we have an issue then that we have about, our agent has gone in, has seen more than just the roof leaking. We've seen holes in the wall. We've also seen evidence of a rat infestation. These are other issues that need to be fixed. I tend to stand behind our agent when they make determinations that these are conditions.
He
deemed to
never
endanger.
say that, you know.
That's beside the
This
point.
is-
This is what we've seen in our inspection.
No, I know.
So now we have, so
You
now
see the rats?
we have evidence of,
I saw the rat feces.
Huh?
I didn't see rats, but I saw evidence that rats were in that
Right.
unit, yes.
and that's all we need is that
How
they.
you see the rats? You see it, no?
Well, that picture that I showed you, in the cabinet, there was a rat's nest and there was a bunch of feces in that cabinet and they had it blocked off.
And is that
so,
wire that was in there to try to block something off? Or is that,
I think that was
Okay.
just in there.
Listen, I know it's true or not. But I'm no bodyguard to that. If he's a rat, I go company, control company, you just play it.
Mhm.
He's never say this start everything to no pay. Everything, you know, should 6 months, you take 5, 6 months apartment, you pay just 2 months.
like I said, sir, the
Right.
payment thing,
You know, tell me you have rats, you know, tell me this, you know, tell me nothing.
well, that's our
When I
job. to
call
do.
them to pay the rent,
That's our
next
job.
week, but boss no give me the check. Bank, I have frozen money, this, I have tenants 40.
I understand.
3 years in a property.
So we need to talk specifically about what the violations listed are. payment-
Violation is no problem, gonna be fixed.
Payment or non-payment's not an issue, so I hope we cannot discuss that.
No,
any
no,
further.
I know, listen, I'm mad. So that's why they start, they do on purpose to not pay the rent.
Like I said,
You
that's,
should pay the rent and ask for repair or anything, something. You just 6 months, can be bad for 6 months.
so the rent or not, the non-payment of rent is not up for discussion. That's not something we're here to talk about
No,
tonight.
no, but you doing purpose, everything will trouble.
That's,
I'm gonna fix it, I'm gonna throw him out. There's
so,
no problem, you know?
so we have the problem where we've gone in and we've made our inspection. And we've
I
seen these
know,
issues.
I
We
I
can't
know
verify,
say
we
you
can't,
guys that I'm
Excuse me,
doing
sir.
something wrong.
Excuse
I
me.
don't say that.
I understand. Please let me finish. So we have a situation where at the very least, we need to go back in. And we need to have evidence that the roof leak has been fixed. We've seen that you put a new roof on. But we need to be able to verify that. But there are other issues too. So there's
Well-
structural issues with the,
Listen, you can't put fix the sheet right inside if it's a roof not been done. Therefore, it's the roof, and
Yes.
after gonna be done. But the guy, you know, let to go inside. You see me on the sidewalk and on my property. This song, you know what I mean?
so that's a big issue. So it's a big issue. You can't get in, we can't get in. So,
See, how are you gonna fix it? I can't fix it.
well, we know there are
For,
these
uh,
issues here.
For the
Right.
street, for inside, I have to go inside, the guys. I'm gonna hire guys, gonna go inside and fix it, It's no big deal.
So does the apartment, each of the apartment have a way out besides the
Yeah.
main door?
They have, yeah,
But our agent hasn't seen that and we haven't
Where,
verified that.
where is it?
every apartment here, you don't see it, because you don't go another apartment, you go one.
Right,
I show you what is there.
okay, but each unit. I mean,
You see the
it
balcony,
should have
in the front, the balcony,
yes,
they have one door for to go to balcony.
but that's on the second story and there's no ladder down to the. There's a window.
Yes.
That they, and there's like this, it's,
It's
you can
no
call it,
window like door, yeah.
you can.
They've
someone
been like,
could
like
fit out
this,
of
I
it,
buy the building
sure.
30 years ago, they've been like this.
But then it's one story drop down onto the pavement
Yes,
without any kind of ladder, so I didn't, sure, it's a window that someone could fit out of, but what are they gonna do when they get out
And
of
is
the
that, is
unit?
that considered a second egress in the building code?
Yeah, they've been
I
like
don't
that.
know.
I don't believe it is.
I think you need to have some sort of ladder, but,
Okay,
I'll
Lara,
double
if
check.
you need it, we can
Well,
put
Sure.
Lara,
the-
no big deal.
The fact of it is
Things
it,
like that.
the fact of it is it's highly likely that it does not have two egresses that you can safely get to the ground. So being that the case, it's still uncertain. We can get the building inspector to come in and to
Yeah.
weigh in and say,
Sure.
okay, but that requires us to get into the apartment again, which we're having difficulty doing.
I think we can arrange for that to happen sooner than later. Like I said, I think it's just a scheduling thing, but, yeah, I think we can arrange that.
I need,
So,
because I think, I have two guys work for me, I can hire, go inside, go the list and fix everything, it's not big deal, problem. And I take picture after you, if he do, I should take a picture before he move. That's why I do it, because not paying purpose.
Okay,
If they, why
I take you
take
for,
that
I take you for your
apartment?
word that you desire to fix these things.
Yeah.
I'm not
I'm gonna
questioning
fix it,
that.
it's No big deal. Okay.
So my
Well,
question is,
Well, I've had a bed like this, 6 months, it's not 6 years. When you start not paying, he broke things, that's why you wanna go away.
Sure.
Loser, you know?
So Jimmy,
Sure.
can you set up a time where we could go back in and take a look at the?
Yeah, I can fix it,
unit?
no problem.
we have,
No, we have to go in and inspect it to make sure that there is a safe egress. There are two. For safety, these are the codes, we have to go by what the law says.
Yeah, yeah, they
No.
haven't, they've been like this, you have on. You have windows, the front, and then they got one window for escape out.
all right, so my suggestion is,
And area balcony over there, in the front.
my suggestion is we have to get back in. And we have to have, if we want to get specific clarity from the building department, we can get that, but we need to get back in. The landlord is asserting that there are two egresses. We have a disagreement, we need to go back in, and also we can see if the roof leak has been fixed.
mhm.
So it seems at this point,
Yeah, they have, I
And-
know,
and-
make it, I know lie, they
Yeah,
go, they
We
show
have to
you.
make sure that the second egress from the balcony is safe, even for children to get down. You have that a bit, you have that?
Don't I have, a ladder, don't I have.
So we can't have people jumping from the second floor to the first floor.
yes. That's not,
Or you can put the ladder.
but there isn't one there now,
Huh?
there isn't one there now, in all likelihood, there's
No,
only one
yeah, no.
egress. Right,
See, I don't lie, I don't say yes or no, but we told them.
So that's
The
what we're
door.
looking for, so,
Yeah,
thank you
about-
for coming, but.
If you don't have, we can put. It's not
So-
big.
so there's two
Huh?
things, so we can either, for the board to consider, there's two things, we can either say, we can push this out another month to our next meeting. In the interim, we can try to get in for an inspection. Or, as our agent has recommended, we condemn this unit, but that condemnation doesn't take effect for a number of months, which allows for some of these things to happen.
Correct. It would allow, sorry.
So go ahead.
Because there has been difficulty with the landlord is saying he's having trouble getting in there. We're having trouble getting back in for reinspection.
Mhm.
So this may necessitate us putting a condemnation order to take effect in, say, 60 days.
So
Which
if we condemn the building, does that
is
mean
just
that
the unit.
the people, the inhabitants that are in the building has to leave right away? Is that, or are they given a certain amount of time?
That's what I've put as my recommendation on the table, is that there's enough here where I don't feel like it's safe for human habitation. But given the housing crisis that we're experiencing in the Berkshires and just how hard it is to find emergency shelter, I don't want these people to be put out on the streets, and so, yes, when you condemn a unit,
Listen,
if you
I
have
can
it
fix
take-
it, it's no problem.
if you have it take effect immediately, they're without housing. So I think offering a length of time would allow the landlord to make some repairs.
Yep.
And an option would be, within that period of time that you've set, if all of the violations are corrected, you could rescind the condemnation. with an inspection from your health agent and all of that confirmation.
So it,
Or it would give time for the occupants to be put on some emergency housing lists and bumped up.
so it seems like if we did a condemnation of the unit to take effect in 90 days, that would give ample time for work to be done and completed, or for them to find alternate housing.
Sure.
And, but yet they're not in violation of, tomorrow, because we issued this, so the order is gonna take effect in 90 days.
The
But it
correction order
will-
still
Oh, I can fix
stands.
it, 90 days. Good.
We understand that, we understand, but we have to have something in place that holds the occupants' feet to the fire to say, you gotta get out of here. And it also gives you time to do that repair, and if not, then it's a mechanism. We've been down this road before, and we've had instances like this, and it can drag on and on. And I'm leaning
I
towards,
see the roof.
yeah, I understand that,
Your
sir.
roof,
I understand.
$20,000.
Before you
I understand.
continue, the occupant, someone that lives in 179 Main
Yeah.
is here, so before we end this discussion, or,
Yep,
sorry, we just need to give everybody a chance to speak during this public hearing, so,
Yeah.
you wanna,
okay.
invite the occupant to weigh in?
Sure,
on what
just-
we've discussed?
Peter, any thoughts so far?
Only that I would probably lean towards the 60
I'm
days
here.
over the 90 days.
He's there.
Okay,
Yeah, he's
okay,
there.
well, we'd like to hear from the tenant now. Could you, just your name, sir, for the record?
Morton Hankey?
Martin?
Morton.
Morton, okay, thank you. Please go ahead, sir.
Well, we've got written hand receipts. This guy wants cash. We paid him every month up until, what was it, July? When the hole in the ceiling started. I told him I wasn't paying him until he fixed it. I had the money in my pocket. He came in with a guy. They went up, they looked at the roof. He came back down. I gave him the money.
Next day that you come.
And they were supposed to come back. They never came back. It took them 2 months to get back here and fix the roof. They just fixed the roof this weekend with no permit and no warning. Some guy popped his head down through my attic hatch, scared the shit out of my daughter. And that's the only thing he's done so far. Now, every time he showed up here, it's always unannounced. He just comes and knocks. We've let him in every time he showed up or wanted to, or unless we're not home. But that case is, he still always came in here every time. So he's only not gotten paid for 2 months, but we gave him first, last, security, and paid him every month we've been here until the hole in my bedroom ceiling started. I got a 3-month-old baby here, and he's breathing in, blowing in insulation and whatever crap else is in here. I got a big crack in my living room wall from the water coming from the ceiling, from the roof down through my wall. The guy in the store below me has been having problems since 2 months after he moved in there. He's got a sign in his window right now telling everybody to go to his other store location because of the crumbling conditions of this building and everything, because he hasn't done anything to help the guy that's renting the store downstairs. This guy is full of shit and he's lying. He said he's not a liar, but he is. We paid him every month, and we've got a written receipt.
Slumlord and many people have said it.
He's got 40 units, but he can't afford to fix the building, and there's no way he's going to put a fire escape on the back of this building in 90 days. There's a ladder out front here that's about 6 foot long that we're supposed to drop to the ground to get down with our children, but that's a front entrance. We already got a front entrance. There's no entrance to the back. Like, there's no escape to the back of the building. And the building has dropped like 14 inches. This guy, when we moved in, he sounded sweet as can be, like things are going to be fixed, things are going to be better. He's lying about fixing the place and painting it. I knew the people that lived here before, they're the ones that painted it. They painted the purple walls in here. I know the people. I'm friends with their mother. He's so full of shit. I'm sorry, but listen to you, Jimmy, just got me flamed, buddy. 6 months, no rent. You are full of shit. I got a written receipt for every month.
Sir, we have to ask you to not use expletives in this meeting.
I'm sorry, sir. I just got really heated. I got a video recording of water pouring down through our ceiling fan in the back bedroom before he fixed the roof. I mean, we've kept records of everything, and he's done nothing to fix anything. He came here to get his money, and that's it. I've got little dents in my door where he comes and taps with his ring every month, any day he feels like, without saying when he's coming, just to get his money. And that's just, I'm sorry. I got really hot when he said all that. We paid him until the hole in my ceiling started, and he never came back to fix
And we
it.
would never complain either.
And we never
about
complained about anything. We just thought things were going to be fine. He was going to fix them up. Everything was going to be good. The reason that we weren't able to use the stove, I'm not saying the stove doesn't work, but the oven door wasn't even on the stove when we moved in. I had to put the oven door back on, and I don't know if you've ever done that before, but the springs are so damn hard, it just about breaks your finger if you slip. And then
Okay.
the thing tips about 8 inches to one side. You can't cook on it. It's beans. And
Okay,
you put like
so,
a 1,000-gallon propane tank on there. I can't afford to fill $1,000 propane tank to cook with one stove. It's the only thing it controls.
so Morton, we need to, so what we're discussing tonight is a condemnation of that unit, because there are repairs that we feel, there are
Oh,
issues that.
absolutely. And I apologize. We were supposed to meet with Rebecca again, but we were down in Connecticut with family and stuff. Stuff was going on, and she's more. You guys can come tonight, tomorrow, anytime you want. You're more than welcome to come in here. We
Well, that
just
will
weren't in
help.
town on our scheduled meeting. That was all.
That will help us considerably if we can get back in during this whole
Anytime.
process.
Anytime. I'm here.
Now, literally.
Even Jimmy can come in anytime he wants. He does. He was just here this weekend with the cops and everything.
I've never, ever.
I don't know what was going on, but
Okay, well.
and also I'd like my car cleaned off. These guys did the roof and just doused the top of my car with old shingles and stuff. It just littered my car with it and didn't clean it off. That's kind of upsetting. My car might be crashed, but it's my car. I'm gonna fix it.
If you have pictures of that, you could show us when we,
I'm gonna go take pictures of it. I'll give it to you when you come, or you'll see it when you come. It's right behind the building.
The mess that you had to clean up from the pool.
Do they fix the ceiling? Is the ceiling fixed?
No, the ceiling's not fixed. They just did the roof this weekend
they just
with
did the
no
roof.
permit or anything. They just showed up to do it on a Saturday morning, woke everybody up, and like I said, some guy, I don't know if you can see it on the camera or not, but there's an attic
Okay.
hatch. Some gentleman popped his head down through it. My daughter was walking out of the living room and pretty much scared the crap out of her.
Okay, so it sounds like the board is leaning towards condemning this unit, but that condemnation is not gonna take effect for 60 days. In which time,
90 days first, which would,
Pete-
which do you mean?
Peter's leaning towards 60
No.
days. I'm fine with that too.
Okay,
Because the roof is a major thing if that's been fixed.
okay.
But just so we need you to understand what that means, and that, we'd like you to see you in different housing ultimately.
No, I understand. We've been looking. We've got people looking for us also. We've been looking.
Anyway.
Okay, and I believe, have you talked to them about the
I
condemnation
mean, we
process?
took this unit because there was nothing else, but at the same time, like I said, he was a nice guy when he moved in. My wife came over and looked at it and talked to him, and he made it sound like he had just been fixing it up and he was gonna continue fixing it up or whatever. Yeah, wanted a nice family here to rent it, didn't want to deal with any kids like, teenagers or anything like that. But the
Yep.
thing is not fit for a family. I can't have my kids here. There's 2-inch, 3-inch centipedes running around here every day. My daughter's scared to go in and take a shower. It's like, I want to get my kids out of here anyway. Believe me, I've been trying.
Okay, very good. So is there anything else that you haven't said that you'd like to say?
Can you think anything?
Talk to
Right now.
them.
Well, let me see. I got everything written here. Infested with insects and rodents, the leaks, the electrical issues. Yeah, there's outlets in my daughter's room that haven't worked since we've been here. Like I said, the ceiling fans and the lights don't work in the living room or in the back bedroom. We got a handwritten lease with this guy. He had my wife write the lease. And this is what he plays. Our neighbor said the first year that they lived here, the first year he bought the building, he tried telling them he didn't pay rent for a year. So now he makes sure he gets a handwritten receipt and gives them a check every month. But we've been paying since we've been here. And
If you could, if you could provide
shows
that,
up on there.
piece of that for our agent, that'd be very helpful for Rebecca.
I'll have everything for you.
Yeah, we'll have it
Yeah,
all.
no place for storage, we got no access to like the basement or like the breaker board or anything like that. We have no idea where even is. So like if a switch or a light went off, we'd have to wait for a week for them to show up. And then,
Yep.
yeah, and then the whole stuff with the ceiling, yeah, the clean, I ended up cleaning the mess up when it was all leaking, and 5-gallon bucket came down on my head where they must have put it there to catch the water, but,
Oh, okay,
yeah, and then like, yeah, we've had rats in the kitchen twice now in the past month. Before that, it was just some mice. We caught the mice. I taped off the kitchen cabinet under the sink because I can't believe they didn't even clean it up before we moved in. It was just loaded with rat feces. They had like wire in there to stop them from coming in, but there's a big hole, like it's all cut out and everything. I tried putting a little bit of spray foam in there that rodents won't chew onto, but it's just so massive that you couldn't fill it. So I just duct taped the thing closed. And then like one of the first month we were here, we probably caught like 6 mice, which was no big deal. Then we didn't catch nothing for a while. And then in the past, like about a month ago, my daughter was screaming to my wife in the middle of the night that something was going on in the kitchen. I run out there and there's like a 10-inch rat sitting under my hut
I just found a
that
skull
ran
right
back
by
off
our
into
door.
the wall wherever. I have no idea. And then just the other day, there was another one in here that took off again. I walked out and it was like right in front of the refrigerator and it ran around and went. Oh, and when I moved my shed out back, I had to move my shed. When I moved that, there was one big rat and about 20 babies that just took off down over the riverbank. So there's definitely a big rat infestation in this building. Downstairs, there's a basement that nobody has access to. There's like 2 or 3 garage doors down there. And I can't imagine what's living down there right now because nobody's been in there and I don't know how long. And I don't know what's in there.
Okay,
But I
Okay.
know there's got to be so much mold and mildew in this place also. Like I said, that roof's been leaking for years and going down through my wall to the store downstairs. And the guy in the store said he's been asking Jimmy to fix it for 4 months now. And it comes through and it stinks. And I mean, finally he fixed the roof after we got the hole in the ceiling, but it took a while.
Oh,
But yeah,
okay.
we paid him. That's not the issue. That's not why we called, and that's not why we made a complaint. We made a complaint because it took him 2 months that the hole was still in my bedroom ceiling.
I understand. All right, well, we would like to proceed with this tonight. I think we're all aware of your perspective now. So, from my perspective, hearing from the tenant, hearing from the landlord, hearing from our agent, I'm not comfortable postponing this for another meeting, just to go around this whole conversation again. I believe we should follow a recommendation of our agent Rebecca, and we should condemn this unit, take effect in 60 days. And if we can get back in an interim, and if repairs can be made, great. If they can find alternative housing, great. That'll allow the landlord to fix the apartment. But so this won't take effect till 60 days. It'll give us time to hopefully.
Now, are we allowed to get our first, last, and security back from this guy to help us get a new unit?
That's a question for a lawyer.
No, I'm not
Martin.
thinking.
That's
You know, you owe me 3 months.
I don't
that
owe
would
you
be
3
something.
months. I don't owe
Yeah,
you
that-
anything because of the unhealthy conditions. I don't have to pay you to live here when
Why
it's
you
like
take the
that.
apartment? You just take it
Gentlemen,
now. I got
gentlemen, please,
People leave.
please, gentlemen,
No, no.
this is not up for
Okay,
discussion.
people live 40 years of
The
this.
rent is not up for
I'll get a
discussion.
lawyer. We'll go to court. That's all right. I'm sorry. I just wanted to ask if it was gonna be something simple, but apparently not.
I understand. That's the question is fair enough. Any other comments from the board before we take a vote on this?
I don't have anything.
Peter?
In August and this month, that's all we want for.
AC back on.
I hate to bring this up, but I can't imagine that there isn't similar issues in other units.
Yeah, the
Well-
other one should be inspected.
It may be, but we haven't got a complaint yet for that.
Okay,
Maybe
got it.
we will, maybe we won't. So hearing no other comments from the board, I will look for a motion to condemn this unit to take effect in 60 days.
I make a motion to that effect.
I second the motion to condemn the building.
Now that I'm on camera, I can.
Okay.
Okay, and we'll take a roll call vote for the record. Peter,
Aye.
Ruby?
Aye.
And I vote aye as well.
There's the hole in the ceiling.
Yeah, here.
All right, thank you, Morton. We'll be in touch.
They're sure you showed them pictures.
Thanks, Lauren. I'm gonna put you back into the participant room, okay?
All right, Rebecca, just call Allison and set up, you can come whenever.
Okay, we've been in touch.
Thank
Okay.
you.
All right,
Good night.
Good night, guys.
and we'll be in touch, Jimmy, when we can get back in for another inspection, and we'll continue this process. But as of to now, this unit is condemned to take effect in 60 days.
So based on the violations that I outlined, I've recommended that I don't think that this unit is fit for human habitation based on all of the violations of the housing code. And so the Board of Health has voted to condemn the unit. So because there's a family living there, they don't want to have this take effect immediately because that means then that family has to leave immediately. So they've extended the condemnation to take effect from 60 days from now. So on November 7th, the family will hopefully already be out. They will already be out, and into some other emergency housing. But you can no longer rent your unit until the Board of Health has come back to certify that it is
I know,
now
say, I'm gonna
safe for
fix
human
it,
habitation.
Yes.
I'm gonna fix it, everything.
But now they have to leave by then, by the 7th. And when, at such future time where all the repairs are done, and we can go back in and inspect that, then you can then rent that unit again.
I'm not the problem, I say.
Right, but for,
See.
as of right now, you can't rent that unit again.
You take it the apartment and
I-
put gun.
Sir,
You took
I've
it,
gone over
take
this
the
many
apartment,
times, sir.
Right.
The rent,
And anything you
financial
do wrong because you don't pay the rent. You lie, I found my phone, about see, my phone dead.
So
There's
if
no charge.
you can take the occupant to court for not paying rent, that's just not something that the Board of Health.
Okay, I wanna fix it, those, hire company, fix it, with the foundation, I'm gonna go fix it. Fix the roof, 20,000, we're gonna fix inside. One, couple wall,
did you, this isn't a building permit. Did you get a building permit for the roof?
see, I know fix the guy take the building.
He
permit.
got the permit?
I, sure he got the permit.
Are you
He's a
sure?
builder,
Well, that doesn't mean he got the permit.
huh?
Did he show you
We
a
can
copy
follow up on
of
that
the
and
permit?
see.
I just thought I'd mention that.
See, the company is not $20 job, it's $20,000 a
Right.
day. His license, insurance.
Well, as part of our reinspection, we'd like to see a copy of that permit that was pulled for the roof.
Yeah,
What the
that's
time
it. I
comes.
got, you say you
Just
pay in full, I give you a copy and then.
That's the receipt
guy-
of the permit from the town, that the town issued him, the permit that he
The
got from the town.
company, I know fixed the room.
I know that, but they should be able to give you a copy of the permit that they pulled from the town building department.
I don't know, you talk to him.
You have to ask him. That's your job.
Yeah,
sir.
I tell them to get.
Yes.
You got the
All I'm saying is,
insurance. you
next
got
time
the-
we see each other, if you can have a copy of that
You got
building.
license, you got insurance, you got everything. I got car for him.
Yes,
The guy, he have 30 people working for
I
him.
understand that, but we would like to see that. Ask him for a copy of the building permit he received from the building department. That would be
Okay,
good.
he told me he took it. I
Okay,
know,
all right.
because,
So our business tonight on this issue is concluded. You have our judgment and our vote.
you see, everything he say, he lie. I got in my phone, I tell them I'm gonna evict you, no pay the rent.
That's,
I have,
sir, this business is done for tonight.
and I know, what he say,
That's neither here nor there.
I have
First.
tenants 40 years, 15 years. He said, no problem, 3 years. You see, you have in a back.
Well,
on,
Sir, we don't want to discuss
no,
this
one
issue.
second.
This
One
issue is
sheet.
closed, sir. This
I
issue is
know.
closed, with all due respect.
Yeah, I'm gonna call, I don't know what to call, fire department, he got no register, broken vehicle in the back.
Call who you need to call, sir.
Huh?
Call who you need to call. And we thank you for coming in.
He,
We thank you for
he
speaking with us.
lied. He say, yeah, this one. What do you have? He have nothing. I can fix it, no problem. I can build new building, no problem.
Okay, sir.
I don't say not, I'm not gonna do it. Because I call the company, take time to come.
We will be in touch, sir.
You got now, you do, not gonna leave.
Okay,
I got 20 years warranty.
Okay.
Anyway,
we have to move on now. Thank you for coming in again.
no problem, I'm married, it's not by you guys married. But the guys, it's no business, the guys is on something, on nothing.
Okay, we're going to
Okay,
move.
and now I'm gonna call the guys and give him the list, can fix it. Inside,
So I'll follow up in writing with the condemnation letter tomorrow or Monday to you. I'll send it in the mail, just like I did the correction order. And when you want to get in to make repairs, you just have to give them in writing 24 hours notice.
okay, no
Okay,
problem,
and so
I know, I can,
If you can document that and then send that to us, that will also be helpful, that you've posted a note or sent them a text message. And, if it comes to that they're repeatedly not letting
I'm
you
not gonna
in.
go inside, I'm gonna Well, the
But that's,
guys.
those are
then
your
again,
next, those are the next steps, is that you will follow up in writing with the condemnation notice, and then if you want to get in to make repairs, you just give them 24 hours notice. And
Yeah, no
if they
problem, I
agree
can
to
do
it,
that.
then you can go ahead and make those repairs.
Okay,
All right?
But anytime I can believe the guy.
sir,
I go
sir,
to
we're done with this
Saturday,
issue. Sir, we told you, we need to move on. with the meeting.
He told me.
We need to move on.
Yeah, okay, no problem. So the letter you're gonna send, I'm gonna come pick up.
I'll send it
We'll
to
send-
you.
You have the address?
Yes, your mailing address?
Yeah,
Yes.
okay. Yeah, okay, and I'm gonna call the company. So the letter is gonna fix it, anything, no problem to fix it. The people, the doctor changed hands, no fix on sheet. Yes.
Thanks, Jimmy.
Yep, thank you for coming in, sir. Okay,
Thank you. Maybe I'm mad, but.
I understand,
Thank you.
I understand. Okay. We will now move on to the citizen speak time of our meeting. We have someone in person in the room who's
Think she gets
patiently
precedent
waited through in
Coming in.
in appreciation for attending in person. We will start with her first.
If you heard from where I'm sitting,
Yes, if anyone else would like to speak tonight, just raise your hand and we'll take them as we see them.
all right, so I'm Donna Jacobs, I live at 260 Park Street, and I'm here to address the everlasting Housatonic Water Works debacle, all right? And I'm here to, actually in response to reading 32-page Department of Public Utilities letter to our Board of Health, that addresses topics where they continue to receive consumer concerns and questions. And it was a very, very interesting letter, I thought, because it seemed to me to really empower our Board of Health. That you all saw the letter from the Department of Public Utilities? It's sent to you on June 30th. It's 32 pages.
Sent to our department?
Yes, to our Board of Health and Board of Health agents.
Maybe it was, I don't remember it off the top of my head. Can
Do
you
you want
send
me
it,
to send it to you?
please? Yes, so we
Sure.
can look at it now.
I'll take down your information, but just let me finish my very fast comments. I would urge the board to work with our PWS, which is our public water system, also known as HWW. I'm tired of HWW. I like PWS. I think we have to move off the animosity and start working together as a community with the DPU, the BOH, the Board of Health, the Select Board, and our PWS, our delivery system, to address the longstanding problem with unsafe levels of contaminants in our water, and to file a petition for leave to intervene in the HWW's rate increase proposal. So I'd like our Board of Health and Select Board to join the Attorney General's office and filing a petition to intervene in that the hearings for that rate proposal. I do believe it's time for a coordinated, comprehensive approach to finally provide safe water to more than 800 households in Great Barrington. Much has been done in the assessments of the system. Now it is a time to obtain large-scale funding through government grants. Some of those are linked to the letter that was sent to you, and loans to assist our public water system, our PWS, and our tax-paying citizens. Our Board of Health not only needs to be on board in this effort for the citizens' sake, it's your mandate from the DPU, if that makes sense to you. So I think it's time that the Board of Health weighs in and files a petition to intervene in the hearings to stop the rate increase, which is a Band-Aid effort, putting the burden of funding on the back of the ratepayer who's already paying extra for water and lugging it around town to get it home and rationing it at home, because this doesn't last very long. It's been going on for years, and it's time that the funding is obtained through government resources, that our systems are somehow fixed. I've been studying this. I'm new to it. You all know a whole lot more about it probably than I do, and I just think it's time for the Board of Health to weigh in with the Select Board on this issue and representing this. And I'll take your information. I'll send you a copy of that.
Sure.
Okay.
And maybe get my card, we'll move on to the next person.
Okay, you can, my email address is when you're ready.
Okay. Are you on the?
I should be, it should be there, but I can give you my email address. All right, it's my last name, LANOUE 33 @gmail. And if you just want to send it to me, I can forward it to Rebecca and she can forward it to the other board members.
Okay,
That'll
got it.
make it easy.
Thanks.
All right, great. Thank you. And I see Kathy's name up. Kathy, we'll get you promoted in just a second.
Thank you.
As soon as the clerk of the works is back at her computer. Okay, Kathy, you should be able to speak now.
Okay, can everyone hear me?
We can hear you.
Yes.
Okay, thank you. I just want to say first thing, like after I hang up, I'm going to raise the hand again, and that will be for my husband, but it's both the same email. So just so you know that he should have a turn as well.
Okay, we just ask that you keep it to about 3 minutes or so.
Okay,
As we're
that's
getting late here.
Okay, that's fine. I also wanted to speak a little bit about the Housatonic water, and I wanted to find out if the Board of Health is going to be filing a petition for leave to intervene on behalf of the Housatonic residents by the DPU deadline of September 12th. Since there have been carcinogenic substances in the water that exceed legal safety levels for quite a few years now, we are hoping that the Board of Health will become more involved. For one thing, many people are unaware that the HAA5 does not just affect people by drinking, but also dermally when showering and by inhaling when doing dishes and so forth. So most of the people that I talk to are not aware of that. They haven't heard it from anywhere. And there's been talk, through the select board about funding to help residents with filters, but it's only a very small amount. Many people are probably going to get just drinking water filters, and that's going to do nothing to protect them from the shower and doing dishes and, breathing it in and other things. So we hope that you guys will take some action on that, as well as file the petition for leave to intervene. And we heard that through the grapevine that Great Barrington may be filing that petition for the leave to intervene, but they have not done so far. And it's only till September 12th. So if you could really take a look at that, I'd appreciate it. And then just a couple of quick other things. I just wanted to thank you, Michael, for your comments earlier regarding masks. The studies about carbon dioxide issues were very well done, and it's extremely important that everyone carefully review those, especially for children. Not to mention the fact that many masks used are not FDA approved or tested for toxicity in and among themselves. So, I really appreciate you bringing that up. And it's also important for everyone to read the Cochrane study. That study clearly shows that masks really didn't work. They've had a lot of research now all over the country. And since the Cochrane is the global independent network of researchers and professionals, that particular study is really worth looking at. Last thing,
excuse me, can you send us those studies?
I can send it to you, Ruby. I've seen that one. That's one of the ones I was thinking of.
Do you know which journal it's from?
There are some that have been published. I'll get the information to you. But the Cochrane study is a well-known one, that institute.
Yeah,
I'm not sure where they published exactly off the top of my head.
I was wondering if the speaker would know.
Do you know, Kathy, where that was? Where it showed up?
I saw it directly on their website. So, I follow the Cochrane, and I mean, and everybody's talking about it. Many health professionals are talking about it. And you have to take into consideration, a lot of the organizations that are promoting the masks right now, they've been, approached with FOIA requests and proved legally to have covered up information and not come through with everything. So I think it's important to look at these studies because they're very well known and they're accurate.
Okay.
Last but not least, I just wanted to make a quick mention about the mosquito control project because our experience with them wasn't that great. I mean, I've heard from a number of people that they don't actually turn off the trucks when they're supposed to, when neighbors request. The other thing is that we found out about them by driving behind a truck in Stockbridge. They're legally supposed to turn off the trucks whenever anybody's within any kind of distance driving, we were smack behind them and they were spraying. I didn't even know what was happening until I smelled something like Raid. I know it's not Raid, but that was our experience with them. So, and Columbia County, New York, their Board of Health would be great to talk to, because the last time we spoke with them, it was a while ago now, but they've done extensive research and they said that the spray that they use will take out adult mosquitoes along with all other insects, including pollinators that are in flight, but otherwise useless except for spreading chemicals on gardens, waterways, and lawns where children play. So with only 2 cases of West Nile in the entire state, it doesn't make a whole lot of sense to spray carcinogenic chemicals everywhere. And last point is for testing. I can understand wanting to test the mosquitoes in the larvae and find out what's happening, of course, but it seems like the mosquito control project would be a conflict of interest since they make their living spraying these chemicals and are going to be trying to sell their product and services. So that's all I had to say, and just thank you for tonight.
Okay, thank you, Kathy. And I know you,
Leave her up.
yeah.
So, yeah, okay, go ahead.